Hello everyone, today we are here to discuss the previous year NEET questions on locomotion and movement. This is the part 3 video. So moving on to the questions. The lower jaw in mammals is made up of mandible, dentary, maxilla, angulars. So let's look at the solution. So this is the jaw of lower animals, the amphibians, that is birds and stuff. But here they've asked us the mammals. So just the maxilla is the upper jaw and mandible is the lower jaw in mammals. But to look at dentary and angulars, a name that is not much here. So let's look at the explanation given. So dentary, dent refers to the teeth. So dentary is the part of the lower jaw that contains the teeth, and it connects this part of the bone to the other part of the bone. So this is the angle of the lower jaw here. So the angulars refer to this portion, that is the which gives the L shape or approximate L shape to the angulars. This connects the dentary to the other parts of the lower jaw. So in mammals the description is simple. The upper jaw is maxilla and the lower jaw is mandible. So the dentary in the mammals is mandible with teeth bearing area. So the lower jaw is made up of mandible or jawbone. So the functional unit of contractile system in striated muscle is myofibril, sarcomere, Z-band, cross bridges. So this is actually a factual question. So the contraction is caused by various cross bridges, myofibril. Yes, so we tend to get confused. So the contractility as a whole occurs in the sarcomere. So the functional unit is basically the sarcomere. So all three that come into the sarcomere. Sarcomere is the functional unit of contractile system. So the answer is sarcomere. A skeletal muscle consists of a bundle of long fibers running along of the muscle. Each fiber is a single cell with many nuclei. Skeletal muscles is also called striated muscle because the regular arrangement of myofilament creates repeating pattern of light and dark bands. Each repeating unit is a sarcomere, the basic functional unit of the muscle. The borders of the sarcomere are Z-line, which line up in the adjacent myofibrils and contribute to the striations visible with a light microscope. So moving on to the next question. The number of floating ribs in the human body is 6 pairs, 5 pairs, 3 pairs and 2 pairs. This is a frequently asked question, so we have to be very clear about the ribs that we have. So there are 7 true ribs and we have the next 3 false ribs and we have the 2 floating ribs. So the floating ribs are 2 pairs, that are 4 in number. There are 2 pairs of floating ribs, 11th and 12th pair. These ribs are not attached to the sternum or cartilage of any other rib. They protect the kidneys. So why we call them floating is they do not have any sort of attachment. They are just floating in the whole body serum. So next, moving on to the next question. What is a part of pectoral girdle? So glenoid cavity, sternum, ilium and acetabulum. Glenoid is a part of pectoral girdle. So glenoid bone, sorry, I thought the picture was attached. So the glenoid cavity, basically we have the scapula here and we have the glenoid cavity, we have the acromion here, we have the clavicle bone here. The long bone of the humerus attaches to the cavity here. This is called glenoid cavity. Sternum is the sword shaped bone that is present in the ventral aspect of our lungs, ventral aspect of the chest. Ilium is present in the pelvic girdle. Acetabulum is also a part of some other bone. So the answer is glenoid cavity. It is a shallow concavity on the lateral side of the pectoral girdle, to which the head of humerus fits making the shoulder joint. Long bones function in option A support, support erythrocyte and leukocyte synthesis, support in erythrocyte synthesis, erythrocyte formation. So long bones are forming the axial skeleton, so their major function is support. But we also know the bones are the major producers of erythrocyte. But we also need to be very clear about the concept that they also give rise to the leukocyte synthesis. So what happens is, basically in the bone there is a common intermediate of a precursor cell that is formed, and then there is a myeloid and leukoid precursor. That is, the myeloid forms the RBC and the leukoid forms the leukocytes. So you have to be very clear that they form support, erythrocyte and leukocyte synthesis. So long bone gives support as well as their bone marrow, the peripheral part, synthesis blood cells in humans. So both blood cells, that is erythrocyte and leukocyte, are also produced. So moving on to the next question. The deltoid ridge occurs in radius, ulna, femur, humerus. So this is a factual question. So the deltoid ridge is present in the humerus bone. So let's look at this. This is the humerus bone, that is the upper limb, and we have the deltoid process, which is the deltoid tuberosity. That is, there is a small elevation here, that is the deltoid ridge. Deltoid ridge is present in the ventral side of humerus, that is the bone of the upper arm, which provides attachment point to the muscles. So the answer is humerus. Moving on to the next question. Number of cervical vertebrae in camel is more than that of a rabbit, less than that of a rabbit, small same as that of whale, more than that of horse. So this is quite a tricky question. This is basically a logical question. So we see here, we have to remember the fact that the cervical vertebra in all mammals, bat, whale, camel, humans, it's all constant, that is 7. So we have to look for that the rabbit is not a mammal, and also horse is not a mammal. So we know mammals here is whale, so, and it is given that it has same amount of cervical vertebrae as in camel. So the answer is same as that of whale. All mammals have 7 cervical vertebrae in their life. It is one of the unique features of mammalian characters. Though they become long in a camel and giraffe, the number is 7 only. As whale is also a mammal, it also possesses the same number of cervical vertebrae, that is 7. So that is same that of whale. So moving on to the next question. Extremities of long bone possess cartilage that is calcified, fibrous, elastic or hyaline. So calcified, it cannot be calcified. If that is calcified, the joints will not be able to move. Fibrous cartilage will not allow the movement of the bones. Elastic cartilage is too fragile to be in the extremities. So hyaline cartilage will give the correct strength and also the movement in the extremities of long bone. So hyaline cartilage is present. It's glass-like cartilage. So hyaline cartilage forms cushion or pads upon the articular surfaces at the joint of long bones and is called articular cartilage. Its role in adult body is to withstand forces of compression and torsion at the joints. So moving on to the next question. Haversian canals occur in humerus, pubis, scapula and clavicle. So Haversian canal, it is a part of long bones. Haversian canal is this. When we take a cross section of the bone, we see that there are various small amount of concentric circles, and then there are interconnecting canals. So this is the structure of a long bone microscopically. So humerus is a long joint, whereas pubis is not, scapula is not, clavicle is not. So only in strong long bones there is presence of the whole Haversian system itself. So Haversian system is a part of Haversian canal. Haversian canal is a part of Haversian system. So the logical answer is it is present in humerus. It can also be present in tibia, fibula. So most long bones. So the answer is humerus. Haversian canals are a characteristic feature of mammalian bones present in the matrix of bones. They are present in the humerus bones. So moving on to the next question. Select the correct statement with respect to disorders in muscles in humans. Rapid contraction of skeletal muscle causes muscle dystrophy. Failure of neuromuscular transmission in myasthenia gravis can prevent normal swallowing. Accumulation of urea and creatine in joint causes their inflammation. An overdose of vitamin D causes osteoporosis. So, rapid contraction of skeletal muscle cannot cause dystrophy. Muscle dystrophy is when we have not used the muscle much. As we become old or when we have become bedridden, we don't use the skeletal muscles much. So they go for dystrophy, that is, they start degenerating. Failure of neuromuscular transmission in myasthenia gravis can prevent normal swallowing. Yes, this is correct. Accumulation of urea and creatine in the joints cause their inflammation. So, the overdose of vitamin D causes osteoporosis. No, vitamin D overdose will not cause osteoporosis. It can cause a reduction in calcium level in the serum. So, the answer is myasthenia gravis of neurotransmitter in myasthenia gravis. Failure of neuromuscular transmission in myasthenia gravis can prevent normal swallowing. Actually, in NMJ, we have to have neurotransmitters. If there is no neurotransmitter, or if there is antibody in the neurotransmitter, there is myasthenia gravis. There is no neuromuscular transmission, so there will be no contraction of the muscles, that is necessary muscles also. In the at the end, the respiratory muscles will paralyze, and so the death will be by respiratory paralysis. So even swallowing, opening of the eyes, such facial expressions are also affected in myasthenia gravis. So here accumulation of uric acid crystals is only present. Myasthenia gravis is a chronic autoimmune muscular disease. It causes the breakdown of neuromuscular junction, due to which brain loses control over the muscles. The symptoms may cause drooping of eyelids, difficulty in swallowing, muscle fatigue, difficulty in breathing, and inability to control facial expressions. So moving on to the next question. Select the correct statement regarding the special disorder of muscle or skeletal system. Muscle dystrophy, age-related shortening of muscle. Osteoporosis, decrease in bone mass and higher chance of fracture while advanced aging. Myasthenia gravis, autoimmune disorder which inhibits sliding of myosin filaments. Gout, inflammation of joints due to extra deposition of calcium. So muscle dystrophy is not age-related shortening of muscle. It can be age-related when we don't do any activities. It is not shortening of the muscle, it is wasting of the muscle. Osteoporosis is a decrease in bone mass, and so there is a higher chance of fracture. Myasthenia gravis is an autoimmune disease, but it will not inhibit the myosin filament sliding. It will inhibit the neuromuscular transmission. Gout is the inflammation of joints, yes, but it is due to the deposition of uric acid crystals, not calcium. So the answer is B. Osteoporosis, decrease in bone mass and higher chance of fracture with advancing age. More causative factors of osteoporosis are imbalance of hormones like calcitonin of thyroid, parathormone of parathyroids, sex hormones, and deficiency of calcium and vitamin D. So moving on to the next question. Low calcium in the body fluid may be cause of option A, tetany, anemia, angina pectoris, gout. So when there is low calcium in the body, there will not be any proper muscle functioning. So there will be prolonged contraction. So this is called tetany. So tetany is a feature of low body calcium. Anemia is when there is a reduction in RBC, circulating RBC count. Angina pectoris is the acute chest pain that is spreading to the left shoulder. Gout is the deposition of uric acid crystals in the joints and cause their inflammation. So low calcium level in the body will also result in low calcium in the sarcoplasmic reticulum. So there will be no proper contraction or relaxation of the muscle. So this is the tetany is a side effect. Tetany is caused by reduction of calcium level due to underactive parathyroid hormone. So moving on to the next question. Parathormone deficiency produces muscle cramps or tetany as a result of, as we saw in the previous question, lowered calcium level, enhanced sodium level, enhanced blood glucose level, enhanced blood calcium level. So the lowering of calcium hormone only leads to the tetany. So parathormone released by the parathyroid elevates the level of calcium in the bone. What it does is it resorbs the bone. It in simple term, it destroys the bone and it puts the calcium in the serum level. So thereby serum calcium increases. The deficiency of this hormone lowers the blood calcium. As a result, the excitability of muscle and nerves increases, causing tetany, that is sustained contraction. Thank you for watching the video.